Health Minister Joe Phaahla says the protest at Kalafong Hospital in Pretoria is unnecessary. He visited the hospital following action taken there by Operation Dudula members. It's believed they've been blocking undocumented foreign nationals from accessing hospital services. Phaahla admits the healthcare sector is under pressure, but condemns those who take matters into their own hands. Our reporter Pulele Tweety-Jones is following this story and joins me live. Thanks so much, Pule. So the picket has now ended. How did Operation Dudula, the health minister and hospital management come to a conclusion eventually after what I believe was stun grenades being used at some point today?
Well, clearly from running away yesterday, they came back today to regroup and come up with better plans that would speak to the demands that they've been wanting to address for a while. We understand that after the scuffle that unfolded today between members of Operation Dudula and members of the EFF, the health ministry and the management of Kalafong were cornered to actually come up with solutions that would speak to that crisis, because here is a situation where the lives of patients is at risk, and of course we're hearing allegations of the workers there being intimidated. So clearly they had to reach each other, find each other somewhere and come up with amicable solutions which would speak to putting an end to the picket. So from what we're getting is that there was an agreement that was reached in terms of how there would be the facilitation of foreign nationals coming into hospital when wanting to access health care. But at the very same time, we understand that this will be a peaceful transitioning which will not discriminate patients who come to the hospital. And therefore, it seems as though members of Operation Dudula, who, by the way, today reclaimed their turf from the EFF, were happy with what was put on the table. And they're saying that they're happy with what the health minister had to say regarding the situation. Perhaps we can just listen to the clip that the minister was there and had to say about this whole problem.
We could enter into proper discussions with our, if we have good regulations, we can enter into discussions with the governments of our neighbors, because they have a responsibility. Every government has a responsibility for its citizens. So we need to also hold them accountable for their own responsibility for their citizens, and where they cannot, even ourselves. I mean, if South Africans are going to go to Namibia to seek help, I mean, the Namibian government must hold us accountable. If, for instance, we are unable to provide renal dialysis and people are flocking to Namibia to get renal dialysis, they must hold us accountable to say, we've got your people here who need dialysis, we can provide it, what are you going to do to compensate us? So those are the kind of things which we need to put into regulation, and we are members of SADC, for instance. The majority of the challenges are in the neighboring. We have regular meetings of SADC under the SADC Secretariat. So those are the things which we can properly table in those meetings.
So, Pule, tell us a little bit more exactly about the solutions and what it entails, because obviously the rights of foreign nationals to access healthcare have to be protected, and hospitals can't discriminate against who they treat and who they don't. That's part of their Hippocratic Oath. But how is it going to be facilitated?
Yeah. Very interesting enough as well. That clip is just almost sort of a preview of the response we're getting from the health ministry. In that detail there, you get a sense that the health minister, Joe Phaahla, is saying, look, we need to go back to the drawing table, speak to governments of other governments of the neighboring countries. Of course, this would include Zimbabwe, this would include Botswana, other countries, and see how they can regulate, most importantly, the influx of some of their fellow countrymen coming to the country wanting access to health practitioning facilities and, of course, health medical care. And this will speak to some of the SADC protocol laws as well, which they may have to adhere to. So it seems government will go to that solution and speak to some of these neighboring governments. This, of course, comes in the wake of some of the remarks that were made by the Zimbabwean President, Emmerson Mnangagwa, saying that we were being a bit lenient on some of those who were undocumented in the country. So it seems as though our government is pushed against the corner right now, and they seemingly have to act. They're getting pressure from unions as well, who are saying the health ministry has been sitting on this problem for quite some time. Therefore, the unions are proposing that the Health Ministry and government look into this matter. It be a debate in Parliament. It be some discussion, robust discussion, that will try to seek for solutions that speak to not the discriminating of patients, but how can they regulate these patients coming into some of these hospitals, because it has a ripple effect on how hospitals operate. You find in such incidences where health practitioners are complaining about how it's a strain on them, how they have to over-cater for some of the patients coming in. So clearly it's something serious and urgent that the Health Ministry and government has to look into speaking to the governments of the neighboring countries, and of course facilitating and coordinating this message through the embassies in the country as well.
Absolutely. We've seen a couple of instances recently. I remember the one at Rahima Musa Mother and Child Hospital, where we saw photographs of foreign nationals sleeping in corridors simply because there wasn't enough bed space in the wards to cater both for South Africans and the influx of foreign nationals trying to seek out medical care facilities there. And certainly this is going to have to take a multidisciplinary approach to fix it. But have the Department of Home Affairs spoken up in the last 2 days, seeing as we're seeing so much activity again around the foreign nationals issue outside Kalafong Hospital?
Well, you're quite right to say this is something that needs a very disciplined approach. It doesn't need any committee or council. It needs commitment from government. What we're getting a sense that the unions are saying Home Affairs should now come to the fore and table their own solutions as to how they will be addressing this matter. We haven't heard from them yet. In the past 2 days I've been there, I haven't witnessed any official from Home Affairs, but clearly it means that they will be looking into this matter. They have been very active in terms of addressing the issue of undocumented foreign nationals in the country, and hopefully the minister will speak to the Minister of Health in terms of how they can work together and ensure that they look into this matter urgently, because this is a warning, Annalie. This is a warning. What we saw was a group taking the law into their hands due to a problem which they believe government hasn't been responsive to for years. So as much as this agreement has been signed between the two parties, of course, Operation Dudula and the Health Ministry and the management of Kalafong Hospital, they are of the view that if nothing happens within a particular set date, of course, of 14 days, they will be back again at the entrance, blocking the entrance, and of course, enforcing their own agenda.
And Pulile, this is a problem that we're going to see escalating in the coming months. Obviously, at the end of December, the Zimbabwe exemption permit, those also fall away. So suddenly, there are going to be a lot more Zimbabweans in South Africa who will find themselves classified as undocumented or illegal. And then the question remains, will they be able to access healthcare services safely? But that's a question for another day. Thank you very much. Our reporter Pulile Treaty-Jones covering ongoing protests outside Kalafong Hospital, which we believe have now been resolved with an agreement between Operation Dudula and the hospital management, as well as the health department.